I'm a general practitioner. I did my medical training at Otago University, having first completed a Bachelor of Science majoring in anatomy. I am opposed to this legislation. Water is a municipal issue. If people don't like the way the DHB handles things, they can choose to not access DHB services. At the moment, people can choose to live in a fluoridated or a non-fluoridated area. Cash-strapped DHBs do not investigate harms that occur to certain individuals from fluoride. It is disturbing, but it is a reality, that changes in medical paradigms occur with difficulty. Maybe you came to this select committee with the assumption that fluoride is good for teeth. From the evidence, you can learn that assumption is flawed. There are better, safer ways of improving dental health. DHBs should be here for our health. It is only appropriate for them to fluoridate if they can provide a safe dose to each individual that is receiving the treatment. This is not possible when fluoride is put into the water supply. Different people have different abilities to remove toxins from the body. People with autism generally have less effective detoxification. Hence, they may suffer neurological effects from drugs and chemicals in the environment at levels that are not toxic to others. Fluoride is one of those toxins that some of us have less ability to clear than others. Removing fluoride from water is difficult. Fluoride is absorbed through our skin when washing. I spent almost $10,000 on a whole house water filtration system to reduce my fluoride exposure. Many people have no possibility of spending thousands of dollars on reducing fluoride. At present, some people can move to a non-fluoridated area. We need to retain this democratic right. If this legislation is passed, it is likely DHBs will take the retrograde step of fluoridating all public water. They don't have the resources to take a different opinion from the Ministry of Health. Fluoride is bad for bones, brains, hearts, kidneys, guts, testes, our endocrine system, including thyroid. You have fluoride measurements from 19 of my patients, mostly suffering hypothyroidism. They show higher than normal fluoride levels. The ratio should be less than 3.1. The highest ratio, 22.2, was in a child with autism. It is not acceptable for DHBs to be given responsibility for saying water should be fluoridated without making them responsible for proving their level of fluoride is safe for each individual drinking it. These results show fluoride is not at safe levels for everyone currently exposed to it. Fluoride is not an element our bodies need. Fluoride contributes to hypothyroidism in a number of ways. The thyroid gland produces the precursor hormone T4. T4 has 4 iodine molecules. An enzyme, deiodinase, removes an iodine from T4, converting it into T3, which is the active hormone that gives our cells energy. A way fluoride is toxic to us is by interfering with our enzymes. Fluoride is an inhibitor of deiodinase, so a person affected by fluoride can't make enough T3. An English study shows hypothyroidism rates are higher in fluoridated areas compared to non-fluoridated. Fluoride seriously affects bone. It causes toxic effects on osteoblasts, the cells that rebuild our bones. Fluoride increases osteoblasts, but they function abnormally. This is seen in osteoarthritis. You may be familiar with the knobbly joints, osteophytes. Fluoride increases osteophytes. As politicians, you will be aware of the great cost to our country from the need for joint replacement operations. It must seem incredible that DHBs aren't taking into consideration the evidence showing a correlation between fluoride exposure and osteoarthritis. My guess is they assume this data is only relevant in countries where there's a high level of fluoride in the water. The reality is every individual is different. There are individuals in New Zealand who suffer more arthritis pain when they are exposed to fluoridated water than when they can escape it. Osteoporosis, weak bones, is another serious health problem. It's common in the elderly. Often the elderly drink tea. Tea is naturally high in fluoride, and boiling water increases fluoride concentration. Elderly people have less efficient kidneys. This are some of the factors making elderly people in general...
We're just about to
more susceptible to receiving a harmful dose of fluoride than the general population. A study of cadavers in Europe comparing fluoridated and non-fluoridated areas showed women with the most severe osteoporosis and the highest amount of fluoride in their bones. Allow us our current choice to live in unfluoridated districts. Protect our health, save money, uphold democracy, don't pass this legislation. Instead, get the Ministry of Health to improve our dental health with a non-controversial, effective and safe program such as the Child Smile toothbrushing programs in preschools and schools.
Thank you.
Very good.
Thanks very much.
And thank you for sitting so